So clearly you've heard of the term respiration. That's bringing the air in and out. Well, we have external respiration and internal respiration. So external respiration is the exchange of those gases between the body's tissue and the external environment. So here we are in the lungs, and it has to get into the blood, and that's external respiration. Internal respiration is the movement of oxygen and into the tissues. So external is getting it into the body, and internal is getting it into the tissues. So pulmonary ventilation is the actual physical movement of air into and out of the lungs. And as we talked about with the diffusion of the gases, the oxygen and carbon dioxide, it's across the respiratory membrane. And that respiratory membrane consists of the simple squamous epithelium of the alveoli and the simple squamous epithelium of the capillary and the basement membrane between them. So we want to talk a little bit about volume and pressure. So in a closed system like the lungs, so if you close your mouth and your nose and nothing is, no gas molecules are going in or out, if you change the volume in your lungs, it will change the pressure. So if your lungs were to increase in size with the same number of particles, it would decrease the pressure. So here we have the normal lungs, with each dot represents an air molecule, and then the size of the lungs expands, but it's the same number of air molecules. This is a lower pressure. On the other hand, if we decrease the size of the lungs, you're going to have a higher pressure. So it's a volume thing. If you've got the same number of particles, increasing the size of the lungs will decrease the pressure inside. So what we do to breathe is we change the shape of our lungs. And we do this by, number one, contracting the diaphragm. When you contract the diaphragm moves downward. And on number two, you move the rib cage upward. All that is going to increase the size of the thoracic cavity. Once you increase the size of the thoracic cavity, the pressure that's going to increase the size of the lungs. And it does it because of this. Imagine you have two sheets of glass, and you put them together like a sandwich, and you put a little bit of water between them. You can slide them back and forth, but you can't pull them apart. That is exactly the way our membranes work. So we've got the membrane, the visceral pleura that's right on the lungs, and the visceral pleura that's outside of that, and it's right on the thoracic wall, and those membranes are stuck together. So if the thoracic cavity expands, then the lungs will expand. Now, should you have a puncture wound into the lungs, it would cause air to enter and the membranes would fall apart, so it wouldn't allow the lung to expand, and the lung would deflate. It would collapse. That's called atelectasis. It's the collapse of a lung. So here we have our lung. There's the diaphragm. And once, right now, the pressure inside the lungs is the same as the atmospheric pressure outside the lungs. So there's no air movement. Just like with diffusion, things move from high concentration to low concentration. Well, we have wind on this planet because we have more air molecules moving to an area of fewer air molecules. So you go from high pressure to low pressure. So there's going to be a flow of air if there's a region of high pressure versus a region of low pressure. So now we're going to inhale, and we do that because the diaphragm contracts and moves downward. The rib cage moves upward. So now inside the lungs there is less pressure, but outside it's the same. So that atmospheric pressure, even just slightly greater than inside here, air will flow in. When you exhale, the diaphragm moves upward, the ribs come downward, the volume of the thoracic cavity decreases, and air flows out. And it flows because air is always moving from high pressure to low pressure. And we don't need to worry about these different intrapulmonary pressures and alveolar pressures. And here is a short video on those pressure gradients.
When the diaphragm contracts and the rib cage swings outward, lung volume increases. The increased volume causes a decrease in pressure within the lung. As a result, air pressure inside the lungs becomes lower than air pressure outside the body, and air flows from outside the body into the lungs. This process is known as inspiration. The reverse occurs during expiration. The diaphragm relaxes and the rib cage swings inward. Lung volume decreases and the air pressure inside the lungs becomes greater than air pressure outside the body. Expiration then occurs as air flows down the pressure gradient from inside the lungs to outside the body.
So we will look at the muscles that cause this to occur, and the primary inspiratory muscle is the diaphragm, as well as the external intercostal muscles. So you can see the diaphragm is this huge cup-shaped muscle that moves downward. And these external intercostals, you can see by the angle of them that when they contract, they would move the ribs outward. You don't need to know any accessory muscles at all. If you were to, let's say, why don't you try this right now? Put your hand on your neck. See if you remember where your sternocleidomastoid is on your neck. And inhale deeply. You will feel that muscle contract. So there are some muscles that will act when we're really pulling in the air with more force. So it's an accessory muscle. Same with the exhalation, the expiratory muscles. If you put your stomach on your hand on your stomach and exhale as forcefully as you can, you would feel those stomach muscles contracting to force that air out. So really the only thing you need to know are the primary inspiratory muscles, the diaphragm and the external intercostal. This is showing those accessory ones. Now this topic is a little different. If you've had some lung issues, you may have had some testing done at the doctor's office. They might have used something called a spirometer. If we were in lab, we would use the spirometer. And all you do is you exhale and you can measure how much is going to come out with each exhale or inhale. And there are quite a few different variables here. So there's a couple I'm going to show them all to you, but really the main, we'll talk first about tidal volume. You need to know what your tidal volume is. Your tidal volume, as you're sitting there, not doing any exercise, just relaxing, your tidal volume is the amount of air you inhale and then exhale. It's about 500 milliliters, which is about 2 cups. It's not a whole lot. Now, so you're inhaling 500 milliliters, but check this out. Of the 500 you've inhaled, about 350 mils is getting to your lungs for exchange. But the other's kind of trapped in the conducting area, so it's still left in your bronchi, your trachea. It's still in those passageways. It's not exchanging. So the tidal volume was the amount of air that you breathe in and out, just normally. Okay. The total lung capacity, you can see here on the graph, is the total volume of air in your lungs. That's about 6 liters for males, 4.2 liters for female. Look at that small portion of that you're using daily, just to inhale and exhale. Now, if you were to, let's see, which one do we, so if you were to inhale and then force in as much air as you possibly could, that's almost 3 liters that you can pull in when you're really, really trying to do that. So you can imagine when you're exercising and really pulling that air in with all of your accessory muscles, you can pull in a lot more air. The vital capacity is what you can move in or out in a single respiratory cycle. So when you exhale as much as you can, is the expiratory reserve. When you inhale as much as you can, it's the inspiratory reserve, and then you've got your tidal volume. So the vital capacity is the total amount you can inhale and exhale. But then there's this odd amount here down at the bottom called the residual volume, and this is the amount that stays in your lungs. After you exhale maximally, you still have over a quart of air in your lungs. So I would say learn your tidal capacity, which is this tiny little value here. It is the amount of air you can breathe in and out just normally, and then total lung capacity.